Where we see the biggest patient experience failures is when the patient's not in the office, when they're waiting for their lab results, when they're trying to go through 3 different estimates for 3 different protocols, when they're waiting for that call back, when they know that they have to do something, their partner has to do something, but they can't quite remember what it was. Those are the moments where they feel lost and alone.
50% of IVF patients don't finish treatment. As a field, we're optimizing for cycles completed, but not families built. Inception Fertility integrated their EMR with Salesforce. They built proprietary tools they call Practice Edge and Prelude Connect so they can track each patient and help each patient move forward from first inquiry through graduation. I brought on 3 of Inception's senior leadership. Listen to their voices so you know who's speaking when.
Lindsey, Rabaut, Chief Marketing Officer.
Stillman, Chief Product Officer.
Vanessa Smith, President and COO.
Lindsey shares specific insights about no-shows and cancellations that she uncovered from the EMR CRM integration. Kat shares specific workflow improvements from staff to physicians. Vanessa shares how she's vetting which solutions to scale network-wide. And we talk about how they're getting providers, staff, and patients to drive the process. We talk about build versus buy, automation, scheduling, finance, conversion rates, and attribution too. I also talk about Bloomic. Bloomic is a fertility EMR that sounds like they were built for these exact topics. So if you're interested in these kind of tech-enabled improvements for your doc, staff, and patients, you might go to bloomic.ai and check out Bloomic's demo. I enjoy interviewing CEOs, but this was a cool chance to interview the people that work just under the CEO. And it gives a better picture of how the sausage is made. I hope to do more of these. In the meantime, listen to what Inception is doing. If you like the information in this episode, we're compiling so much more data on new technology in IVF, products, services, market analyses, info on mergers and acquisitions, and data on every company in the fertility space. Go to data.insidereproductivehealth.com. If your company isn't an IVF Heroes Universe sponsor, your competitors are so much more visible to your customers because we report on your category and we give that info to your customers. Go to data.insidereproductivehealth.com to learn more about other fertility companies or submit your company today. Don't be left out.
Today's advertiser helped make the production and delivery of this episode possible for free to you. But the themes expressed by the guests do not necessarily reflect the views of Inside Reproductive Health, nor of the advertiser. The advertiser does not have editorial control over the content of this episode, and the guest's appearance is not an endorsement of the advertiser.
So when families struggling with fertility issues come to our practice, the last thing that we want to do is add more stress to that situation. So every day we're working on solutions, both in the home office and in our clinics, to remove those barriers that patients typically would encounter in physician practices. That really comes from a collaboration with our employees in each of these practices, working side by side with our home office folks in product, in IT, to remove all of those barriers that they would typically see in any other healthcare setting.
What are those barriers specifically?
Yeah. So as we talk to patients, and one of the best parts that I think, Inception really brings to the industry is that we have Dr. Ali Domar, as our Chief Compassion Officer, and she's spent her career really studying patient dropout. And so we have a lot of data that really helps us support this, but we know that it's psychological. It's just stressful. We know that finances play a really large part in it. But I think the thing that's most important to remember is that it's not at any one point. There are like many drop-offs from the day that they go to the website to do their first information all the way through to when they are preparing to have a cycle. There are so many different points of drop-off. And as we think about how to best, like Vanessa was saying, help serve those patients from what we do best. I think that's where we're always trying to think through, okay, is there just something small that we can do that would completely change the experience for our staff and our patients?
Did you find the answer to that? Is there something small that you can do that would completely change the experience for your patients and your staff?
Cat, how many things have we found? It's like playing whack-a-mole, Griffin. It's like every day we're finding a new thing, and I think that that goes to, again, what makes us really special as an organization is that we're never satisfied. We're always looking for that next little thing, but that I think, Kat, I think you would agree with this, like, we don't go for the home runs. We're looking for all the base hits over and over again so that we can consistently be improving patient experience.
What are those base hits, Kat?
Yeah, I mean, so when you think about my area, which is product, the foundation of everything that we're doing is twofold. It's patient experience and then staff experience. So as Lindsay said, we have literally mapped every single journey point of our patients and then every single journey point of our staff. And we've built this technology layer for both our staff and our patients to actually make sure that we're providing proactive care. And so for all of our patients, that tiny thing is they're never going to ask, like, what do I have to do next? And for our staff, they're never going to have to ask, what does this patient have to do next? What have they already done? Where are their results? And so that just seems like a very small thing. Like you should know if someone's lab results come back, you should know what your next step in your journey is. But we all know how complicated fertility is. And so if you don't have it actually spelled out for you in your hand on your phone that you can look up at any time, it's not that accessible. So that's like our number one base hit right there is get the journey to be proactive so that patients feel super supported and that our staff feels like they have the capacity to support them through the journey.
Is the Prelude Connect and Practice Edge you're referring to, or is that something
Yes.
else?
Yes. So our app for patients is Prelude Connect, and Practice Edge is our internal practice management workflow tool that we've built in-house to specifically serve our teams and fertility patients.
Why build it in house? What were you trying to solve for that you weren't finding in the marketplace?
So we couldn't find anything that just stayed true to those core tenets. From the staff side, every single solution that we looked at required double entry of work into the EMR, into the practice management solution, multiple clicks over here, multiple systems over there. What we're trying to do is empower our staff to really focus on the patient and not have to write something 3 times or click 7 buttons. And so building your own technology that actually goes with the process that's the best practice was the way for us to go. And we did the math and it made a ton of sense. Same thing from the patient side. You look at the healthcare apps that are available, they don't integrate directly with a patient's treatment plan the way that a fertility treatment plan works. You need a calendar, you need med instruction videos that you can like easily access. You need all of these documents, you need like access to your care teams in very specific ways. And so we felt after looking at the landscape that we couldn't find anything that would actually serve our patients well. And so we built it ourselves. And we've been able to iterate and iterate off of it. As Lindsay said, like we cannot sit still. So we continue to put out features that we know will continue to empower the patient journey and continue to help our staff. I think we put out new features almost every week at this point, which is really fun and exciting for our teams to be able to see a lot of the feedback that they're giving us put into action in our technology.
The benefit of having it in-house is if you're dealing with a big EMR company, to try to get a little change made in a big system would be very difficult. And so they would only be able to get us to 80% of what we needed versus having it in-house where we could do 100% of the, whether it's a workflow change, a process change, we own it. And that's the benefit both to our employees and to our patients.
Is it also an EMR? Is it an electronic medical record?
It is not an EMR. We still have an EMR and it's a layer on top of that.
Yeah. The systems.
I always like to think of it too as like we make patient facing tools that are for the in between moments when when the patient's not in the clinic. I think so often we think about patient experience being just when they're in front of us, when they're in our office. But where we see the biggest patient experience failures is when the patient's not in the office, when they're waiting for their lab results, when they're trying to go through three different estimates for three different protocols, when they're waiting for that call back, when they know that they have to do something, their partner has to do something, but they can't quite remember what it was. Those are the moments where they feel lost and alone. And you can't necessarily proactively reach out in those situations because you don't always know. But like what Kat's talking about is when we develop the technology that sits in front of or on top of the EMR, we then know exactly where they are, and using, you know, surveys and just lots of different data points from our current patients, we kind of now can anticipate what they are needing at that point, and then the technology can help deliver that before they even know that it's what they needed. So that's what the proprietary tool has just really been so critical for.
The conventional wisdom used to be, Lindsay, that it's marketing's job to get the patient in the door, and then operations takes over from there. That it's marketing's job to throw the ball, and it's the practice's job to catch it. Agree or disagree?
Completely disagree. I mean, I think maybe my job would be a lot easier if that was the case. But no, I mean, we think of the whole patient journey, and that genuinely goes from the first moment that that patient was feeling like, I don't know what I need to do next to get pregnant, all the way through to them holding a baby in their arms. Because quite frankly, if for us it also doesn't stop at graduation. We've also got our field sales team that continues to follow up with the OBs all the way through to baby. We genuinely want to see our patients from day one to day baby. And so marketing is all the way through. And honestly, operations is also all the way through. It's also not just on me to bring the patients to the door. Our operations team, our product team, they're all facilitating me to bring patients through too. So I do see marketing as like the conduit that kind of brings patient to the care that's going to change their lives, but I'm still with them all the way through.
I actually thought of you when I was listening to a Scott Galway talk. It said it's the end of the CMO, that CMOs are over. But I thought of you. I was like, not CMOs like Lindsay, because that's what marketing is now. It's not just about getting patients in the door, because frankly, back to that analogy of throwing the football, doesn't matter if you're Tom Brady and you can throw like that. If the practice can't catch it, nobody gives a crap. So in order to be valuable as a marketer, you have to help to see the journey all the way through. And now marketing is about the comms and the experience that connect the journey from beginning to end, and then loop it back as a cycle so that your patients at the end are your new patient generators because they're sharing their delighted experience. And
Well,
Vanessa, I'm
Griffin, oh, sorry. I was just going to say real quickly too that I think we're all navigating a brand new world since 2024, where the patients that are coming in the door are different than they were pre 2024. I mean, as you think back to Alabama and then the presidential election, IVF becoming a hot topic in every living room, when you never would have thought that, like, pre 2024, to think that, like, my grandparents would be asking me about IVF. It just wasn't that, it wasn't on our bingo card, right? But now awareness has gone through the roof. We've got normalization of the category, all these really great things. But what that means is that you've got more people that are interested in learning, and not everybody's as ready as they used to be. And so from a marketing, product, and operations standpoint, we also have to make sure that we're meeting people where they are in their own personal journey, because they might be, to continue your football analogy, they might be on the 5-yard line, the 10-yard line, or they might be at the 50-yard line. And we want to serve all of them personalized in a way that is right for them.
And I'm gonna say this because I'm a huge fan of Scott's, but I'm not a huge fan of saying that chief marketing officers are, going to be benched. I really see Lindsay as my growth partner. She's my chief growth officer, and she's helping me to continue to grow the business, grow, our patient population, and our baby population as well. Scott might be right that the CMO of the past might be on the bench, but
We have to adapt.
I'm with you on that one, Vanessa. And I think I'm with you on the wanting to build some things in house. But if you have to work with an EMR, then aren't you not really like building, like, can you really build something on top of it? Aren't you super dependent and enslaved to the EMR?
I mean, really, the EMR is just a medical record, right? That's where all the good stuff, the vitals,
That's what
and
it's supposed to be, but most practices still use it as an operating system.
Yeah. We've pulled out from, I mean, our EMR is there for medical records, but our practice flows and works inside of Practice Edge, and the two work very closely together. They're super connected. You're never doing double entry. Everything flows bidirectionally. So we're empowering them to do more than what an EMR can provide at this point.
And I think it's important too to make sure we say that, we're not team build everything ourselves. We look at, again, with the taking every piece of the journey, we look at, should we build it? Should we partner with somebody? And we do both. And we do both really well.
Most fertility clinics don't have a patient journey problem. They have a systems problem disguised as a patient experience or patient journey problem. Behind the scenes, you got Frankenstein EMRs, disconnected tools, and teams wasting hours chasing information instead of caring for patients. That's where Blumic.ai comes in. I've checked out a couple of EMRs recently, and there seem to be a couple that are built for the new world, might have a little bit of an advantage because they seem to have a deep fertility experience, especially being incubated in a fertility center. They built a unified platform designed specifically for fertility clinics. So you get real-time data that gives you smoother workflows, and patients get the experience they deserve. I'd recommend checking out that demo if you're serious about scaling without burning out your staff. Check out Blumic.ai and go to that demo. We'll also link to it in the show notes. So as you're building this, Kat, how does Practice Edge and Prelude Connect interface with each other, or are they completely different systems?
Yeah, the kind of the way I like to describe those two is like Prelude Connect is for patients only. But if you think about like an iceberg, it's the part you see above the water. And then Practice Edge is the giant iceberg below the water, empowering all of those teams. So Practice Edge is where every one of our team members logs on every morning and goes through everything that they need to do throughout the day. It tees up the patients that they should focus on. It shows them the messages that they should answer. It brings in all the different patients from each part of the journey so that our teams are all working together and doing more seamless handoffs.
And so the iceberg is one system, though. There are two different entry points to the same larger system.
Mm-hmm. Yes. So the pretty part of the iceberg that you see above the water is for our patients, that app that's in their hands at all times, really showing them what to do. And then everything else under the water, powering and keeping it up, is us on the Practice Edge side.
You said you might be launching a new feature every week. What are some recent features you want to flex about?
Yeah, I think one of the ones that we're most excited about was born from our patients and our staff saying, I want to know what I've done and I want to know what I need to do next. And so we launched a feature called the patient checklist. So every new patient, right after their new patient appointment, has a personalized checklist pushed to their app that says exactly what they need to do. You can click into each checklist item to get more information. You can message your team if you have any questions. And as you go through, there's a progress bar and a check off so you can see how close you are to being ready to start treatment. Because as I said, we've counted the massive number of steps that they need to take. And so being able to see it visually has been a huge help for our patients, being able to know like, okay, I've done my bloods, but I need to do a uterine evaluation still. Okay, I've done this and then I need to do that. Or my partner needs a semen analysis. And what's even better about it is that the partners can join the app together So you'll be able to view each other's checklists and make sure that you're aligned on what your partner has to do next and what you have to do next. And there's some shared checklist items as well. So you can really feel like you're moving through the journey as a team.
And so the patient can see this in list form? Can they kind of see it like in a visual, like a timeline to see like, all right, in order, if I want to get to IVF, I can see this is how long the timeline is and how many steps are. How does that visual look?
Yeah. So we have it optimized for, a phone. So you can vertically scroll through the items that you have, and it'll show you what you've completed and what you have left to do in the order in which you need to complete them. And as things come off the list, they go down to the completed section. So you feel like you've done it. And you can see the timeline bar on the top, kind of getting you closer to being ready to start treatment.
Vanessa, I've seen useful technology before, and I've also seen practices not give a damn and not implement it because they're busy delivering the care that they have to deliver that week. Is that what you're here for? Is that why you got brought to Inception, to start knocking some heads together and get people to use Cat's cool tools?
A little bit, yes. But the reality is, I'm here to ensure that every patient, every time, has the best patient experience. And these tools are going to continue to help with that journey for that patient. I mean, they come to us at one of their most vulnerable times, right? And so any step of this process that we can make it feel better and feel less scary is a win in my book.
What has been the biggest challenge from centers, providers, staff adopting the technology, and not just adopting it? Because I mean, if you get them in, that they're using it, but there's a difference between being a user and a super user. And if you want to get the maximum benefit, you probably need to be a super user. What's been the biggest challenge in getting them to? Is it just their time? Just that, like, man, I that might help me tomorrow, but these are my problems today, and I just don't have time to think about it.
Yeah.
Yeah.
What have been the biggest challenges?
So I think the benefit of being an embedded product organization is that the providers and the clinical teams are actually my people that are helping me create the products
That's what I
and
think.
tell us what the priorities are. So when we go to roll something out, the entire team is actually pretty bought in because they have been the ones to help us scope it. They have been the ones to provide the feedback, and they have been the ones to help us actually make sure that we're delivering something that when we bring it to the clinic, they see the value in. And so they see the value in taking that extra minute to get that training on it or do that rollout because they've really bought into that building process. And that's like a huge differentiator from buying something off the shelf. You can really tailor it to what they need in that moment and make sure that it's providing the value because we don't put out or build technology that's not going to provide value. There is no point in that.
Yeah.
And so it must feed into our product tenants, which is patient experience and staff experience.
There's a lot of stakeholders, though.
Yeah, there are. Well, so for the patient checklist specifically, so we have a physician advisory board, and we have 8 physicians every year who really work with us as an executive team on some critical strategic items. And there, at one of our meetings, we literally, with 8 of our physicians, drew out what this checklist would look like. We have like the original sketches of what it would look like, and then Kat and her team took all of the insights from marketing and from the patient surveys that we do, and they went and they built something and they iterated it, and like got feedback from all of the different practices and built it a handful of times. And then now, as we're rolling it out, one of the things that we do to make sure is that it's all based on the flow sheets. So we couldn't even launch the patient checklist unless we had buy-in on all of the different flow sheets that go into it. Had to get that buy-in up front. And then because we tied it to that, that makes it a lot easier to have adoption. But we're rolling it out site by site to ensure that we're bringing everyone at the clinic along.
8 doctors is a lot. You have a lot more than that, so that's still only a sample, but it's still okay. You're getting a solid group of doctors to really buy in, to have ownership in the process. they're only one of the stakeholders. You got nurses, you got your APPs, imagine that other staff or managers are using this in other ways. Often what I see is when technologies are trying to get implemented, the people at the top were bought in, and by top, I might mean middle, but then
Yeah.
the next layer down is thinking, I'm not really incentivized to implement this. And so, how do you involve the other stakeholders?
Yeah. So
That's a great question.
we have a couple leadership committees. So we have a clinical steering committee that is heavily involved in scoping. That's all of our nurse leaders. And then, as a product team, we seek feedback from all of our end users on a quarterly basis. And so my team is doing constant customer feedback from our internal teams, as well as getting those leaders from MAs and from nurses in this clinical steering committee to really drive and really scope a lot of the details of that. Because you're right, we need buy-in from all levels in order to roll this out.
Do you all go to do the three of you go to the physician summit?
Yeah,
Yes.
absolutely.
Are there two Inception meetings like there's a physician summit and then there's like a big Inception conference, or it's all one meeting?
Great question. So yeah, we've got the physician advisory board, which, like I said, is the exec team plus about eight of our physicians, and then we've got physician summit, which usually has 75 to 100 of our physicians in attendance.
And so do you find that going there is like necessary to get the buy-in? Like as much as you're doing it the methodical way of addressing the pain points, getting them to take ownership, that you still just kind of need that like good old-fashioned rapport building. Like you have to hang out with them a little bit for them to not see you as just some business lady in a different city.
Listen, Griffin, I was in a practice last week. Yeah, I was in a clinic in scrubs, sitting side by side with our physicians and our clinicians last week, watching this in action. And by the way, Kat, I'll have to schedule some time with you. They've identified a workflow issue, but that's how we learn and that's how we get better. It's not just, we're not sitting in an ivory tower making decisions. We are sitting side by side with our team every day to ensure that the tools that we're creating work and that it's, again, adding value to their day to day.
What was that workflow gap that you identified,
No,
Vanessa?
no, secret.
No secret.
Well, tell me some of the workflow gaps that before you're gonna plug something cool, Lindsey. I know, but before we move on to that, the gaps that some of the workflow gaps that you've identified with, I want to hear about like some of those specific things that
Yeah.
other practices might still be struggling. That you feel like we've got a pretty good handle on those. What are a couple of those specific ones?
I mean, the ones that come to mind first are um, the handoffs. So we have a lot of different teams. We have financial counselors, we have nurses, we have MAs, we have doctors, and you're always going to have a little friction in those handoffs and making sure that the patient feels like it's always a warm handoff. And so that was one of the core tenets of some of the features that we've built in Practice Edge was to make sure that the patient doesn't feel like, even though they have to talk to a different person about finances than they do about their treatment plan, it feels like it's all timed correctly and handed off in the correct way. And so the tools we built in Practice Edge based on that feedback really pass that patient from one team to the other in a careful way, using technology and using the appropriate messaging, using a lot of the techniques that we learned from our nursing team, and then passes them back in the same careful manner. And so I'd say like that's one of the ones where, I know that our practices historically struggled with it, and one of the areas that we really focused on.
Did you all measure like nurse call volume at any point so that you could have a benchmark? I think like when we started all the projects in our house, we wish we took an inventory of all the things in the beginning and so that we could see some of the improvements. Did you take any of those benchmarks so that you can see like, oh wait, we can actually see this reducing call volume or reducing time in this area? How are you measuring it?
Yeah, we're tracking everything. We track, the amount of messages we send, the amount of messages we receive, the calls that come in, the calls that go out, the tone of our messages even. We track a lot of all of those different metrics so that we can actually look at them over time, look at them as we roll out different features, and make sure that our products are doing the right thing for our patients and our staff.
Lindsey, please. You were gonna flex on something. I will never
I
deny you a
wasn't. No,
flex.
I wasn't. I wasn't. I was actually going to say that we don't wait for Summit. Like, it's actually pretty rare that the three of us are all in Houston because we're normally out at the clinics. And that's where we're all always seeking feedback and doing that feedback loop. So Summit is actually more of it's us getting together, yes, for the relationship building, but it's also us allowing the physicians to get to talk to each other about clinical things that they want to talk to each other about. It's less about us unveiling new technologies or new products because we've already done that clinic by clinic.
You're on the road too a lot, Lindsey. I don't think a lot of networks are sending their CMOs to individual practices too frequently, but it sounds pretty important.
Yeah, because I'm not just marketing. I'm not just about putting the leads in the door. I'm also about making sure that they've got the right tools for their patients throughout the journey that our sales team or our physician liaisons who are really the conduit between our physicians and the referring OBGYNs. That's also a part of my team, as well as patient experience. And so I'm there kind of from all threefold. I'm not there to talk about digital marketing.
Only if you want to put them to sleep. What have been some tools that you all haven't built that you've been impressed with?
I mean, we are constantly looking at tools in the market. There's a lot of AI tools that we look at I look at a couple a week. I think we've made strategic partnerships in areas, especially in AI, where we think there's expertise outside of what we can build in-house. For example, looking at medical records, and if we receive thousands of pages, being able to receive those more efficiently. That's one area that we've been really looking at. But those are a lot of the really specialized AI models are an area where we've been looking to partner with the right people. And we get to do some pilots, and we've started to look at a couple different things.
Vanessa, how have you been vetting? I'm sure you get calls from a number of different vendors and people that want to, maybe they're in one Prelude practice and they want to be scaled across the network. How are you approaching your vetting process?
I mean, it's really where are those pain points? I mean, if it is a product that, I've heard 10 people raise their hand and say, if we don't solve this as an organization, we're going to, whatever, quit or leave or, find somewhere else to practice. That's the priority is if it's a pain point for the organization, it's a product that we should probably evaluate. If it's not, then it's on the bottom of the list of, calls to take at the time.
Is Prelude Connect a CRM? Would you describe it that way?
No, we describe it as a patient companion tool.
But you do use a CRM, Lindsey?
We do, yeah. And so I was actually going to say that's one of the things that we're not building our own CRM. So we partner with a CRM just like we partner with an EMR. But one of the things that I am the most proud about that I will flex on is the building of the connection between the CRM and the EMR. I think, we were talking about when we were talking about marketing, kind of bringing leads to the door. I think that partially that is because most marketers are in charge of the CRM. And so we have our websites, we're using the CRM to capture that acquisition point of the person who is interested in booking an appointment. We use the CRM to facilitate a booking of an appointment, and then they go into the EMR. So what connecting that CRM to the EMR has allowed is that we now have the ability to shepherd a patient from literally day one through to becoming a patient, through their treatment plans, and then back to their OB. And it took 14 months to make it happen. And it's already paying dividends. It's just been, I'm very, very proud of our ability as an organization to connect those two because it took all of us to make it happen.
Even more than the time it took. It's an accomplishment because there have been people that tried that for 14 years and never really pulled it off. Does the EMR connect to the CRM from Practice Connect, or
They're
they
all
connect with each
connected.
other?
It's all of it. So yeah, obviously we're using API connections, but we're able to hook data now between the CRM, the EMR, and Practice Edge. Practice Edge always acts as that kind of like middle ground for us, but yeah, they're all together. And so for our schedulers, it's that way you only having to put in information once and then it's everywhere.
Are you using HubSpot or Salesforce or somebody we
Salesforce.
wouldn't know for? So, okay,
No, we
so
use Salesforce.
I mean that's hard because it's. I mean, on one hand, like Salesforce works with a lot of APIs, but on the other hand, it's not necessarily the most nimble tool. So
Well,
you
what
work.
we've learned is why it's so hard is within the EMR you have so many changing components. So if a patient changes their appointment, which who doesn't change their appointments these days, right? If you want to change your appointment, if you need to make an edit, the EMR really wants to just duplicate that, and then that's where the CRM is like, whoa, now there's too many inputs. So really thinking through how you're going to build those connections. And then for most organizations, if you've got multiple clinics, you've also got multiple ways of using an EMR. I mean, I think of an EMR kind of like a blank Excel sheet where you open it and you kind of get to build it however you want. And so if clinic A and clinic B have built it differently, that's what makes it impossible for the CRM to input the fields. And so there was a lot of standardization or, making sure that the codes all aligned. There was just a lot of foundational work we had to do at the beginning in order to make it possible. And so like that couldn't have just been a marketing technology. Like it had to be product and IT and ops all together.
Back to why everything needs to be integrated.
Yeah.
Are all Prelude practices on one EMR or are some practices on different EMRs?
All in one.
Yeah. For the most part. I think there's one that's not, but
What specific insights have you been able to that are you able to share that you've been able to see from having a CRM and an EMR that are
so
so
my
integrated?
favorite one that I'll share is actually we were able to now run an analysis based on when you are as a lead when you come in, how quickly you then get scheduled for your appointment. Obviously that matters. But what was interesting to us is actually from the moment you schedule your appointment to when your appointment actually is, there's a tipping point. If you have to wait longer than about 21 days, or cancellation rate goes way up. And it ends up being about 1 in 5 of our cancellations is because that patient was booked more than 21 days out. Oh, I'm sorry. It just kind of lagged a second. So I thought that was really, really interesting. And it sounds so easy, but if you don't have the connections, you can't measure that because the scheduling was happening in a different place than check in, check out. And then the other interesting thing is that no-shows are much more likely if the patient books within a week of being seen. So it's kind of like if you book too close to when the patient calls, they are more likely to show up. But if you book too far out, they're more likely to cancel. And so really then I kind of think of it as like an airline. It's like, how are you optimizing your flights to make sure that your doctor's capacity.
I want to make sure I got that right. They're more likely to no show if they booked that week.
If they book within a week. So like if you call me and I'm like, I can give you an appointment in 3 days, you're more likely to no show for that appointment.
But more likely to cancel outright if they booked much further out. So there's kind of like a J curve. There's a sweet spot. Is that sweet spot like 2 to 4 weeks?
14 days. Yeah.
Yeah, wow. Those are some
So just like one example. The other thing that we are now able to look at, which I can't say the actual data, but we now know by practice and by how did you hear about it? So referral source, so whether you are a Google search lead or a physician referral lead, whether you're at AFCC or Aspire in Texas, we're able to look at how long on average or the median from lead to appointment, but then also from appointment through to any treatment. So if we want to look at IUI, if we want to look at first retrieval, if we want to look at graduation, and we can look at that full timed journey so that we know on average, but then also the on median, because there's a very long tail for each of those. But I mean, that is something that just was unheard of 6 months ago.
There's a breaking point happening in fertility clinics right now. More patients, more complexity, but the same outdated EMRs and manual processes are trying to hold it all together. It's a Frankenstein. When your EMR can't keep up, what happens? Your staff feels it, your patients feels it, your growth stalls. Bluemic.ai is their site, is built differently. Modern infrastructure, real-time visibility. You should check out their demo. I checked it out at PCRS. I checked it out with someone that heads operations for a fertility clinic. I was impressed, but I'm not a clinician. So you should check it out and you should see how they do migrations, because one thing that's stopping fertility centers from switching EMRs is the migrations. They've got a different process. So clinics can modernize without putting patient care, staff, workflows, or growth at risk. It's not just an upgrade, it's how clinics finally scale without chaos. If all that is hitting close to home, check out the Bluemic demo at bluemic.ai. You can go to bluemic.ai or check out in the show notes. Maybe this is tangential, Lindsey, and no one will care about it except for you and I, but I need to talk about it, which is multi-source attribution in marketing. People will just have single source attribution, and some marketers will say, well, if that's what the patient or the customer said was the source, then that was the most important one. I think that's like drinking 12 beers and saying it was the 12th one that got you drunk. You can't you can't have perfect attribution as much
Oh,
as people want it. And I would find when we would do data for clinics and when we did like a 250 patient survey, we'd ask people all of the ways that they heard about a practice or
mhm,
they came to decide on that practice. And physician referrals were super high. But then when you ask people of all of these ways, what was the most important way? It was a much more even split. And so
mhm.
it's like you you can't tell all the story from one attribution source. So how do you account for that?
Yeah. So, I mean, we do ask. We ask a lot of different times too, which is another reason why it was so important to connect the different systems, because we ask you when you fill out your lead form or when you're on the phone with a scheduler. We also ask you at your first appointment, so your nurse would put that into the EMR. But then we also use, sophisticated tracking on the back end to look at things like UTM codes or how they're coming in, so that we can see things like, somebody came in, they said they're a physician referral, but they're in the EMR, but their lead record actually says that they came in through Google search for branded Aspire. They searched for Aspire, they searched for a clinic by name. And so it doesn't mean that the physician referral wasn't who sent them there because they had a different code. It actually means that their physician told them about us. They thought about it. They did some research. They ended up on Google where they researched us by name and then chose us. And so the way I always answer this question is that none of us make any decision in our life based on one point of data. We use all of it. And if we did only go after what people are telling us, we would be so blind right now to AI specifically, because less than 1% of our patients tell us that AI sent them to us. But we know that that is not the case because it is just so ingrained in how our patients are searching very up funnel for things like, why can't I get pregnant? Why has this been so hard? Why have I missed another period? And then when they get to Google and they search on Google, AI Answers is there. And then they search for us and they see us and they click on our link, but Google gets the credit, right? And so when I think of multi-site attribution, I'm just thinking of like, what are the multiple touch points that probably drove that patient to us? And how can we make sure that we're showing up consistently on all of them?
And by the way, word of mouth is still one of the best ways to get a patient. And that is 100% driven by the patient experience. And so as long as our employees are giving a great patient experience when that patient walks in the door, and our doctors give a great patient experience, sadly, you could still have a bad outcome and you don't get to graduate. But if we still serve that patient from the start of that journey till the end with the respect that each of these fertility patients deserves, word of mouth gets us the patient every time.
Word of mouth can't be understated, but even that can be attributed or misattributed. I started in fertility marketing just doing very rudimentary organic social for a couple of fertility clinics. And it was small clinics in the Midwest that I used to just get to light on fire word of mouth, but it was happening on Facebook and Instagram. And it was people that would have normally not been in touch with each other, like your old college roommate, a former coworker, your second cousin. Like you maybe don't speak with them that frequently, or you certainly don't speak with them too intimately about fertility if you haven't been in touch. But now they were seeing, oh, you went through this too, and you went and saw that specialist. And so we made business go up really quickly, and you could attribute that to organic social, but it was really word of mouth. Or you could say it was word of mouth, but it was organic social that made it happen. So there's no easy way of being able to just pigeonhole that attribution, which is why I like your approach.
Yeah. Well, and I mean, what we know is that regardless of the referral source or the attribution source, they all parents or all patients exhibit the same way when they're in the clinic, which is that they're stressed out and they feel like it's hard to move forward, even the ones that are super motivated. I always like we use this analogy a lot of Vanessa, you and I were talking about the other day of a kid on a diving board, like so wants to jump off, like they're so ready, and they're just nervous. And so when we think about the greatest thing we can do for anybody that walks through our door, it's how can we leverage technology so that our staff can be the human interaction for them that helps them take that next step forward. Whether it's that, the person in our clinic is literally like down in the water with a float saying like, I'm going to catch you, I'm going to catch you. Or maybe our clinic, maybe that nurse is right behind them whispering in their ear, like, you can do this, you got this. We want our staff to be there for the human moments because we've equipped them with technology that took the busy work and made it a little less daunting for them so that they could show up for the patient in that human way. And it gets us all emotional every time we think about it because like that's why we exist. And that's what we're equipping our teams to do.
Where does finance come into this intersection of technology and patient experience?
It's built
Good question.
into our app. It's built into a couple of the things that I mentioned earlier. It's built into those really smooth handoffs. It's built into our patient app. So everything is very clearly laid out for the patient. Every patient has a very detailed understanding of their insurance coverage or their financial agreements. They are able to have video consults or in-person consults with their counselors. They're able to, make payments or track anything on their app. So it's all very seamless for them. And then though they're, they're working in conjunction with their clinical team as well. So it's all very, very integrated because it's super important in the patient journey and one of the most stressful parts of it for many of our patients.
Is providers' time starting to be opened up now? Like, can you see a near horizon cat of now the provider that used to see 250 patients in a year and do 150 cycles now in the same amount of time can see 3 or 400 patients and do 250 cycles? Is that starting to materialize, or are there still other challenges that despite the technology we're not able to open up provider productivity like that?
Yeah, I mean, I we think about it in like a slightly different way. We see technology beginning to open up provider time that was not well used before. So the way that we think about our technology is the small things that make the outsized impact. So if the physicians are needing to spend an extra, 30 minutes or plus per patient to really get ready for that visit, how can we help them do that more quickly? And how can we really like stop them from having to click here, go there, print this out, get themselves set, and really free up that time? We're not, there's a lot of flashy things that are saying like we're going to double physician capacity. we're really focused on the things that are going to make impact for our physicians today, and impact on their time today using technology, and really get those like very annoying things that'll burn them out of their practice every single day.
What do you each want providers and staff to understand or to maybe get a better grasp of? And now's your chance because millions of them listen to this program.
Great question. I mean, I think our employees and our physicians are the why we come to work every day to support them. And they are the why for those patients. It's kind of a corny response, but it's truly how I feel.
I think from the product perspective, with a lot of the noise that we hear all around us all the time, like every news article about AI doing this and doing that, and technology doing this and doing that, and disrupting healthcare, what we like to say to physicians is we want to cut through that noise to actually understand where that impact is going to be most felt and what AI and technology can actually do in the next year, 2 years, 5 years, and thinking about the plan to use technology over that different amount of time to impact their jobs, not in this scary way, like AI is going to take everybody's jobs, but in the way that it's going to help you see the patients the way you want to see them. You're not going to have to go to the fax machine, then go to the scanner, then put the scanner into the computer, and then check it in the computer. You're just going to have these things at your fingertips so you can look that patient in the eye and give them the best care that you want. Your nurse is going to be able to give that patient a call because they're not doing everything else that they had to do that day. And so that's one of the things that cutting through all of that noise and kind of that worry that's going around, like to think about the core of what technology, AI can and should do. And it's to increase that human interaction and empower it to be even better. And that's how we're thinking about it in the Inception Network.
Yeah, I think I would just layer onto that we actually, with Allie, did a study that patients, particularly here in the US, would trade success rates, like a percent, not all of them, but a percentage of a success rate for empathetic care. And so technology cannot replace the human connection and that interaction. And what I always want all of our physicians, all of our nurses, our front desk staff to know is that when that patient is right in front of them, nothing else is more important. And so if there is something that is pulling them away from the patient, to let us know what that is, because if we can automate it, if we can use AI to help with it, if there's anything that we can do about it, we want to help so that their focus can be on the patient.
Ladies, not all, but a big chunk of the Inception leadership team, thank you for joining me on the Inside Reproductive Health podcast for this cross-disciplinary look at the patient experience. I look forward to having you each back on.
Thanks for having us.
Thank you.
Go to data.insidereproductivehealth.com. That's where we're compiling so much data on new technology and IVF, products and services, market analyses, info and mergers and acquisitions. Every data point that we can on the field writ large and the companies in the fertility field, we're compiling there. Go to data.insidereproductivehealth.com as we build that over time. And if your company isn't an IVF Heroes Universe sponsorship, your competitors are getting more visibility because we report on your category and we give that to your customers. We do that multiple times per year, and we do it around big events like ASRM and ESHRE. Go to data.insidereproductivehealth.com and submit your company today. Don't be left out.
Today's advertiser helped make the production and delivery of this episode possible for free to you. But the themes expressed by the guests do not necessarily reflect the views of Inside Reproductive Health, nor of the advertiser. The advertiser does not have editorial control over the content of this episode, and the guest's appearance is not an endorsement of the advertiser. Thank you for listening to Inside Reproductive Health.